Hello, and welcome back to EM Note Journal Club, the podcast dedicated to bringing you the latest evidence-based medicine for healthcare providers. I'm your host, James Carter. Today, we're tackling a common pediatric emergency, nail bed injuries. We're fortunate to have Dr. Emily Wang, an expert in emergency medicine, joining us to break down the recent Ninja trial. Dr. Wang, thank you for being here.
Thank you for having me, James. It's a pleasure to discuss a topic that's so relevant to emergency practice.
Dr. Wang, let's dive right in. The Ninja trial focuses on a very specific clinical question. Can you briefly summarize the PICO framework, the patient, intervention, comparison, and outcomes that the researchers were looking at?
Certainly, James. The P, or patient population, included approximately 450 children with nail bed injuries and nail avulsion. The I, or intervention, was the standard practice, primary repair of the nail bed with replacement of the avulsed nail or a synthetic substitute. This was compared to the C, or comparison group, which involved primary repair of the nail bed without replacing the nail. The O, or outcomes, were primarily infection at 7 days and cosmetic outcome at 4 months. They also looked at secondary outcomes like pain and patient satisfaction.
That's a clear setup for a clinical question. What was the study's overall design, and what were the key findings that emerged from this comparison?
This was a randomized control trial, which is the gold standard for this type of research question. The key finding was quite surprising and challenges a lot of traditional teaching. The study found no statistically significant difference in infection rates or cosmetic outcomes at 4 months between the two groups. Furthermore, there were no differences in pain or patient satisfaction. Interestingly, the group that had the nail replaced actually had higher healthcare costs.
That is a significant finding. For years, many of us have been taught that replacing the nail is crucial. What are the limitations of this trial that we should be aware of when applying these results to our practice?
That's a great question, and it's essential for a critical appraisal. While it's a well-designed RCT, there are a couple of notable limitations. First, the follow-up period for the primary outcome of cosmetic appearance was only 4 months. Nail regrowth can take longer, so it's possible the final cosmetic result wasn't fully captured. Second, the trial could not be blinded. Clinicians and patients obviously knew whether the nail was replaced or not. This could introduce some performance or detection bias, though the objective nature of the outcomes helps mitigate this.
Given these findings and limitations, what's the bottom line for clinicians? How should this evidence from the Ninja trial change our practice, and what's the overall EBM rating for this evidence?
The clinical takeaway is that we can likely forego the difficult and often distressing step of replacing the nail in these pediatric patients. The evidence suggests that it doesn't lead to a better cosmetic result or a lower risk of infection. This is a practice-changing finding that allows us to simplify the procedure, potentially reduce procedural pain and costs, and still achieve an equivalent outcome. The overall EBM rating for this evidence is moderate. It's a strong RCT, but the short follow-up and the lack of blinding tempered the strength of the conclusion slightly. The findings are highly applicable to pediatric emergency and primary care settings.
Dr. Wang, this has been incredibly insightful and immediately useful for our audience. Thank you for your time and for helping us better understand this important trial.
My pleasure, James. It's a great example of how evidence can directly inform and improve our clinical practice.